The thought of experiencing a heart attack while alone is profoundly unsettling, yet it's a reality that occurs more frequently than most people realize. Many assume they'll have ample time to react, that the symptoms will be unmistakable, or that someone will be nearby to provide immediate assistance. However, the truth is stark. The first few minutes of a heart attack are critical, and your immediate actions or lack thereof can determine whether you survive. The encouraging news is that even if you're alone, you can significantly increase your chances of survival by acting swiftly and following a clear, deliberate plan. In this comprehensive guide, we'll walk you through 7 essential life-saving steps to take if you suspect a heart attack while alone. These steps are straightforward, require no medical training or specialized equipment, and are designed to help you stay calm, act decisively, and maximize your odds of survival. We'll cover how to recognize subtle early warning signs, what to take immediately, how to reduce strain on your heart, and small but critical actions that can buy you precious time until professional help arrives. Stay with us until the end, as the final steps are often overlooked but could be pivotal in saving your life. Let's dive into this vital roadmap to empower you to take control in a crisis. Step 1. Recognizing the earliest warning signs. The first and most critical step in surviving a heart attack alone is recognizing its symptoms as early as possible. Many people envision a heart attack as a sudden dramatic event with crushing chest pain, like the scenes depicted in movies or television shows. In reality, heart attacks often begin with subtle, easily dismissed symptoms that can escalate rapidly if ignored. Acting on these early warning signs is your best defense against severe heart damage, cardiac arrest, or death. A heart attack typically manifests as a deep, uncomfortable pressure or squeezing sensation in the center or left side of your chest. This may feel like a heavy weight pressing down a tight band, constricting your chest, or a persistent ache that doesn't quite register as sharp pain. The sensation may come in waves, subsiding briefly before returning, which can lead you to think it's not serious. However, if it persists for more than a few minutes or keeps recurring, it's a major red flag. Beyond chest discomfort, you might experience shortness of breath even without exertion. You may feel like you can't get enough air, even while sitting still or resting. Pain or discomfort can radiate to other areas, such as your arms, often the left but sometimes both shoulders, neck, jaw, upper back, or stomach, where it might mimic indigestion or heartburn. Additional symptoms include sudden lightheadedness, cold sweats, nausea, particularly common in women, dizziness, or an overwhelming sense of fatigue that feels disproportionate to your activity level. For some, especially women, older adults, or those with atypical presentations, symptoms may be subtler, such as mild upper back pressure, vague stomach discomfort, or a general sense of unease without clear chest pain. Consider the case of Richard, a 74-year-old man who was sitting at his kitchen table when he felt an unusual tightness under his collarbone, similar to heartburn accompanied by difficulty taking a full breath in sweaty hands. Initially, he thought it might be indigestion from his lunch, but he recalled a health pamphlet warning that heart attack symptoms can be subtle. By acting immediately, he avoided a potentially fatal delay. Similarly, Margaret, a 70-year-old retiree, was reading in her living room when she noticed a persistent ache under her collarbone, clammy hands, and slight nausea. She considered stress or fatigue, but remembered a doctor's advice about atypical symptoms in women. Her prompt action saved her life. Your body often provides subtle clues before a heart attack escalates, and these early warnings are your critical window to act before the situation becomes life-threatening. To prepare, familiarize yourself with these symptoms and take them seriously, even if they seem mild or vague. Risk factors like high blood pressure, high cholesterol, diabetes, smoking, obesity, a sedentary lifestyle, or a family history of heart disease increase your likelihood of a heart attack, so be extra vigilant if these apply. If you experience a combination of chest pressure, shortness of breath, radiating discomfort, or unusual fatigue, stop what you're doing immediately. Don't dismiss it as indigestion, stress, or a minor issue, and avoid the temptation to tough it out. Keep a mental checklist of symptoms and practice listening to your body. For example, note how indigestion or muscle strain feels different from the heavy, persistent pressure of a potential heart attack. Discuss your risk with your doctor during routine checkups, asking about specific symptoms to watch for and whether you have unique risk factors. Practice distinguishing normal discomfort from potential heart attack signs by reflecting on past sensations. Trust your instincts, your life may depend on it. Step 2. Calling emergency services immediately. Once you suspect a heart attack, the next vital step is to call 911 without delay. Do not wait to see if symptoms improve, attempt to drive yourself to the hospital, or worry about overreacting. Calling emergency services is the fastest and most effective way to access life-saving care, and every minute counts during a heart attack. Delaying help increases the risk of permanent heart damage, cardiac arrest, or death as the heart muscle begins to die without adequate blood flow. When you call 911, trained dispatchers begin coordinating a response, dispatching paramedics equipped with specialized tools such as portable defibrillators, oxygen, and medications like nitroglycerin or anti-clotting drugs to stabilize you. They can monitor your vital signs en route to the hospital, which is critical if your condition worsens. Driving yourself is extremely dangerous. You could lose consciousness, cause an accident that endangers yourself and others, or delay critical interventions. By calling 911, you ensure professional help comes to you quickly, equipped to handle a life-threatening emergency. Take the example of Linda, a 78-year-old woman who felt a strange ache in her left shoulder, nausea, and a cold sweat while alone at home. Initially, she considered calling her son to drive her to the hospital, but she recalled a nurse's advice. If you're alone and suspect a heart attack, call 911 first, then contact family. She dialed 911 and paramedics arrived as her symptoms intensified, stabilizing her with oxygen and medications. Similarly, Thomas, a 75-year-old widower, felt an unusual ache in his jaw and chest while gardening alone. He hesitated, worried about bothering emergency services, but remembered a community health seminar's advice to call 911 immediately. That call ensured paramedics reached him in time to save his life. Dispatchers are trained to handle uncertainty and prefer responding to a false alarm over missing a critical case. Keep your phone accessible, especially if you live alone. Many smartphones have an emergency call feature that works from a lock screen. Learn how to use it. Pressing the side button multiple times on an iPhone or using the emergency SOS option on Android. If speaking is difficult due to shortness of breath or pain, stay calm and use this feature. In some regions, texting 911 is an option. Check local availability and save the number. Practice accessing these features and keep your phone charged, especially at night. If you live in a rural area with slower response times, inform a neighbor or family member after calling 911 to assist if needed. For example, you might text a neighbor to let them know paramedics are coming. The sooner you call, the sooner help arrives, maximizing your survival chances. Step 3. Chewing an aspirin. Slowly and calmly. After calling 911, the next critical action is to chew a standard 325 milligram aspirin if you have one and are not allergic or on a blood thinner that contraindicates its use. E.g., warfarin, apixaban, or rivaroxaban. Consult your doctor in advance if unsure. Chewing rather than swallowing allows aspirin to enter your bloodstream faster, improving survival odds. Aspirin thins the blood by inhibiting platelet activity, helping to slow or prevent a blood clot, blocking a coronary artery, the primary cause of most heart attacks. Studies such as those from the American Heart Association show chewing aspirin can restore some blood flow, buying you time until paramedics arrive. Use an uncoated 325 milligram aspirin for the fastest effect. Coated or delayed release versions absorb more slowly, though they're better than nothing if that's all you have. If only low-dose 81 mg aspirin is available, it can help but is less effective. Avoid taking aspirin on an empty stomach if possible to minimize stomach irritation, but in a heart attack, clotting risk outweighs this concern. Consider Joe, a 72-year-old man who felt tightness spreading from his chest to his neck one morning. He chewed an aspirin from his kitchen cabinet while waiting for paramedics, a move his cardiologist said likely reduced heart damage. Similarly, Sarah, a 70-year-old woman, kept aspirin in her purse and chewed one when she felt chest pressure and nausea, aiding her survival. Store aspirin in accessible spots, nightstand, kitchen, wallet, or car, and check expiration dates regularly, as expired aspirin may be less effective. Inform loved ones where it's kept in case they need to assist. If you have stomach ulcers, bleeding disorders, or aspirin allergies, confirm with your doctor if aspirin is safe and whether you should keep an alternative like nitroglycerin if prescribed. Consider carrying a small emergency kit with aspirin and a note listing your medications and allergies. For example, a labeled container with a few tablets and your medical details can be a lifesaver. This simple science-backed step is standard in emergency medicine and can mean the difference between recovery and severe harm. Step 4. Sitting or lying down to protect your heart. Once you've called 911 and taken aspirin, minimize heart strain by stopping all physical activity. Sit or lie down in a safe, comfortable position and avoid moving unnecessarily. Pacing, gathering belongings, or trying to push through increases your heart's oxygen demand, which is already compromised. Your heart is struggling to pump blood, and exertion can worsen damage or trigger arrhythmias. The ideal position is sitting upright, with your back-supported feet flat and arms relaxed, reducing heart effort while keeping you stable. If you feel faint or lightheaded, lie on your side with your head slightly elevated, using a pillow or rolled-up clothing to avoid choking or discomfort. Resist moving even if you feel restless or embarrassed about doing nothing. Staying still conserves energy and oxygen, potentially preventing further damage. Alice, an 81-year-old woman, felt chest pressure and wanted to tidy her kitchen but recalled her doctor's advice. If you think it's your heart, sit down. Everything else can wait. She sat in her recliner staying still, which likely prevented cardiac arrest. Similarly, David, a 71-year-old man, felt symptoms while walking his dog and sat on a bench leashing his dog to stay safe. Identify resting spots in your home like a chair or sofa, and keep assistive devices nearby if you have mobility issues. If outdoors, find a safe spot like a bench or step. If in a car, pull over, safely turn on hazard lights and rest. Mentally rehearse resting calmly to act instinctively in a crisis. By staying still and breathing slowly, you give your heart the best chance to stabilize until help arrives. Step 5. Unlocking your door for emergency responders. If you have strength after calling 911 and resting, unlock your front door to allow paramedics quick access. This small action can save critical seconds, as a locked door may force responders to break in, delaying treatment. Every second matters when your heart is struggling. If you live in an apartment or gated community, ensure your address is visible and consider a spare key in a lockbox or with a neighbor. A smart lock with a code can help share it with 911 dispatchers. Paul, a 76-year-old in a condo, felt symptoms, called 911, chewed aspirin, and unlocked his door. Paramedics said this saved 30 seconds, crucial as his condition worsened. Similarly, Maria, a 73-year-old, used a lockbox code to ensure access. If walking to the door feels risky, prioritize staying still. Prepare by keeping a spare key accessible and informing dispatchers of its location. Stay on the ground floor if possible. In rural areas, leave a porch light on or use a reflective marker to guide paramedics. These steps ensure faster access, improving survival odds. Step 6. Using your phone's speaker or medical ID features. Your phone is a lifeline during a heart attack. Switch to speakerphone when speaking with 911 to keep hands free and reduce strain. This helps you focus on breathing, while dispatchers hear you clearly, detecting changes in your voice or breathing. Set up your phone's medical ID feature on iPhones or Androids to store your age, allergies, medications, and emergency contacts accessible from a locked screen. If you lose consciousness, paramedics can use this data. Susan, a 79-year-old, fainted before paramedics arrived, but her medical ID showed her diabetes and penicillin allergy, preventing harmful treatment. Practice accessing your phone's SOS or medical ID features. Some phones share your location with 911. Automatically test this in advance. In areas with text to 911, save the number. Keep your phone charged and nearby, especially at night. If you use a smartwatch, enable heart rate or fall detection features. These tools ensure critical information is available when you can't communicate. Step 7. Slowing your breath to steady your heart. Panic is natural during a heart attack, but can worsen your condition by raising your heart rate. Controlled breathing calms your nervous system and reduces heart strain. Inhale through your nose for 4 seconds, hold briefly, and exhale through your mouth for 6 seconds. Repeat, focusing on the rhythm. This won't cure the heart attack, but can prevent stress-induced arrhythmias and maintain oxygen flow. Frank, an 83-year-old, felt chest pain and fear, but used a breathing exercise from his doctor. Slow breaths kept his heart stable until help arrived. Practice this during calm moments, like while relaxing, so it's instinctive. Use a smartwatch to monitor your pulse during practice. Other techniques like visualizing a peaceful scene or repeating help is coming can help. If you have anxiety, work with a therapist on coping strategies. This small act of control can buy critical time. Final thoughts: surviving a heart attack alone isn't just luck, it's preparation and action. These 7 steps: recognizing symptoms, calling 911, chewing aspirin, resting, unlocking your door, using phone features, and controlling breathing form, a powerful strategy to maximize survival. Prepare now, store aspirin, set up your medical ID, ensure door access, and practice breathing. Share this with loved ones, it could save them too. Act fast, stay calm, and give yourself the best chance to survive.